Clinical officers? Who are they? Are they just mini doctors or something far more essential to the healthcare system? It's time to debunk the myths and misconceptions surrounding clinical officers. Hi, I'm Dominic, and today, we're going to dive into the reality of what clinical officers do and why they are crucial to our healthcare system. Let's start broad. Clinical officers, COS, are often misunderstood by the public and even by some within the healthcare sector. Many people think COs are merely assistants to doctors, handling only minor tasks. Others believe they are unqualified to handle serious medical conditions. There's also the assumption that COs are temporary stopgaps while the country waits to train more doctors. But that's just the surface. These myths don't capture the whole story. Now let's narrow it down a bit. The reality is that clinical officers are a vital part of Kenya's health system, particularly in rural areas where access to doctors is limited. COs are responsible for diagnosing and treating patients, managing health facilities, and even performing minor surgical procedures. Their role is far from simple, and they often serve as the first line of defense in healthcare, especially in remote areas. You see, COs undergo rigorous training. They aren't just handed a stethoscope and told to go manage patients. They are trained in medical diagnosis, treatment, and patient care. In fact, clinical officers are often the face of healthcare in Kenya. When you walk into a hospital or clinic, it's usually a CO who first assesses your condition, manages your treatment, and refers you to specialists if needed. This brings us to the key roles they play, like in outpatient departments, specialized clinics, and community health programs. Let's go even deeper. Specialist clinical officers, for example, are highly trained in fields like ophthalmology, dermatology, orthopedics, and more. These specialists work autonomously, handling complex cases within their specialties. They not only treat patients but also mentor medical students and junior staff, playing a significant educational role within hospitals. Yet despite their importance, myths persist. For instance, some people think clinical officers are confined to minor medical tasks. But the truth is they are authorized by the Clinical Officers Council to manage a wide range of conditions and are often seen as primary care providers in Kenya. In fact, in areas where doctors are scarce, COs fill a crucial gap, offering physician-level services. The Kenyan healthcare system heavily relies on clinical officers. According to research, they form the backbone of the health service, particularly in rural areas. Without them, many Kenyans would lack access to essential healthcare services. They are not just filling in for doctors, they are professionals in their own right, with a distinct role in patient care and management. In some cases, COs are even more experienced than newly graduated doctors when it comes to hands-on patient care. So, the next time someone tells you that clinical officers are just junior doctors, remember, they are much more than that. They are highly trained professionals who provide critical care, especially where doctors aren't available. They bridge the gap, bringing essential healthcare services to the most underserved communities. Thank you for watching, and don't forget to hit that subscribe button for more medical insights, motivation, inspiration, mental health support, and to follow my journey as a health professional. Let's grow, learn, and inspire together.